Hello and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister. Thank you for having us today again. So this morning, I want to start off with talking about masks. There's been a lot of masks out there since the start of the pandemic last year, but there's been an emerging trend with double masking. Can you say if this gives a person more added protection against COVID-19?
Well, double masking is something that has been talked about, but before we even talk about double masking, it's important for us to differentiate the different types of masks that are available. So you have cloth masks that a lot of people have been making these and using them. You have what might be termed as surgical mask or procedural masks. These are used in healthcare setting, and generally people would put them on when they're doing some procedure. The surgical mask is one that fits much better and prevents infection from the person wearing the mask to get on to the other person who maybe the doctor, the nurse is interacting with. And then you have the N95 mask, which would prevent at least 95% of the particles from getting in or getting out via that mask. So when we're talking about double masking, I don't think it's appropriate for you to add another mask on, say, for example, an N95, because an N95 mask already has 5 layers. You mightn't see it, it looks thin, but there are 5 different layers in an N95 mask. And while it says N95, which means at least 95% of the particles would be prevented from getting in or out, in some cases the efficiency of these masks are much higher. And in some cases they prevent as much as 98% of the particles from getting in or out, which is a really high percentage. So if you were going to use another mask, say you put on a surgical mask over that, that means you're adding another set of layers onto the existing 5. And I don't know how much benefit you will get from that. Recently, the CDC has commissioned a study, maybe about 2-3 weeks ago, and they are now looking to see whether double masking would be an effective way to go and whether to use that. But I suppose when we talk of double masking, is not to use the medical types of masks, but perhaps to more use the cloth mask and maybe add a surgical mask onto that or below, in front of that. So use the surgical mask first and maybe then add the cloth mask on top. If you do that, I can see the value in that, because the surgical mask would certainly prevent smaller particles from getting into the person's respiratory and alimentary systems. So I can see value in that. But to double mask with surgical and say an N95, I don't think you'll get more additional value. So it all depends which mask we are doubling up on.
Okay, Minister, thank you for that. Now, there's a lot of information out there on how to care for a mask. But the question is, a lot of people do outdoor exercising, walking on the seawalls, and so can you say if they should also wear a mask while engaging in these activities?
Generally, it's recommended that you wear a mask in the public. However, if you're exercising, some of the guidance has been if you are far away from another person, then you can take off your mask. And depending on the type of exercise that you're doing, if you're going to wear a mask and do very strenuous exercise, then it would actually prevent you from breathing properly, and that can create another set of problems. So you would have to be careful what type of exercise you're doing, how strenuous it is, what is the demand on your breathing when you do these exercises, and how much people are around you, what would be the density of the persons around you. And if you have a lot of unknown persons that are around you that you're not sure what might be their COVID status, then doing exercising without mask in in such an environment would certainly put you at risk. But if you are in a gym and you're the only person in the gym, and then you can take off your mask and do your exercises.
Okay, thank you for mentioning gym, Minister. I know a lot of people sometimes wear face shields to gyms. What's your take on that?
Face shields,
Without the mask, actually.
yeah, but face shield probably would protect maybe a direct thing to you, but the whole purpose of a mask is to prevent viral particles from preventing you from breathing in viral particles. These are really tiny particles, so they can get under the face shield, and then what happens? You get infected, right? So it's not a face shield. It's not. It's a type of barrier, but it's not a very effective type of barrier.
Okay, Minister. And before we wrap up, I have about 2 questions from the Guardian media in Trinidad. They're asking if you can help them understand the vaccine rollout in Guyana.
Well, we have started rolling out the vaccines after we receive a donation from the government of Barbados of 3,000 doses of vaccine. And these vaccines came from the Serum Institute of India through the government of India. And so that's the one that we have started with. As you know, AstraZeneca vaccine has an efficacy of about 63%. But the expert group by the WHO, the SAGE, has said that if you increase the interval from 4 weeks to, say, 12 weeks between the first dose and the booster dose, then the efficacy of the vaccine goes up from 63 to about 82%. So we are using the larger interval because we want to make sure that the persons who have received the vaccine can have better efficacy with the vaccine.
And they're also asking if Guyana is in receipt of donated vaccines from India, and if so, when and how did the ministry make contact with India to get the donated vaccines?
Guyana is in negotiation with the government of India, and so far those negotiations have been quite positive. So we will see what would come out of those discussions.
Okay, so far nothing has been final.
We haven't received anything as yet.
Thank you for that, Minister. Now, one last question. I know it would have been announced yesterday that we would be opening the borders with Suriname for the ferry service just for Guyanese and Surinamese. Can you say what the PCR requirements would be?
The same as any passenger traveling. So someone coming from Suriname to Guyana would be required to have a PCR test. If that test is done within 72 hours upon crossing over, we'll allow you to go free without any quarantine. If that test is more than 72 hours, then you will have to do another PCR upon arrival. So those arrangements are going to be put in place at the port. And when people come across, of course, they'll have to go through the normal types of screening where we'll check their PCR tests, we'll do the temperature checks and so forth. And once we're satisfied, then they would be allowed to go.
Okay, Minister, thank you so much for that. This has been our COVID-19 update. For more information, visit our website dpi.gov.gy or our social media platforms.